It's really a big pleasure to have you for our conversation today. This space where PAL Network invites one of its members to follow recent developments of their work, to understand the challenges they are facing, and to celebrate with them the milestones they have reached during the last year. And for this conversation, I'm happy to have ASER Pakistan, who is represented today by Zain and Sehar. I have seen we also Hamza, and I'm very sorry if I'm not pronouncing your names correctly. Just as a kickoff, 2021 was part of those very difficult years for all of us because of the pandemic and the restrictions that came with that. So how was your life at ASER Pakistan during the pandemic?
So Armando, as you know that we could not conduct ASER during the pandemic. We missed 1 year for ASER, but we conducted really small pilot. So, during also the pandemic, because the schools were shut down, it was constant school closures, and we're working with the government every now and then. So what we did was we tried to make all these solutions that we had and the survey we had online. So we have tried to digitalize ourselves because of the pandemic, because we couldn't go to the households, of course, and because of the precautions to follow and everything else, we also could not conduct any kind of school service. So we have actually, what the first step was actually to provide the digital content in terms of our service delivery. So we tried to provide all the solutions to the government. We tried to create all the content online, so that, because of course the government was also trying to reach out the kids within the household and trying to provide them with learning materials through TV and try to reach them out through internet and other facilities. So we tried to provide them with the solutions by digitalizing ourselves, number one. Number two was, as soon as the schools started opening up a little bit in the phased approach, and so what we did was that, yes, then we thought that perhaps we need to conduct surveys and see what kind of impact the pandemic has caused within the household and on child's learning. So we have done 3 kind of pilots. Number one, we did the pilot on learning losses, which was conducted in 16 districts by ASER throughout Pakistan. Only 16 because of the pandemic, we could not, go to a very larger scale. So we actually tried to reduce the sample size and conduct the household survey, number one. We also did another small pilot in 4 urban settlements because, of course, due to the the urbanization and everything else, even the big cities are now very crowded. And ASER has not been done in urban settlements till date. We conduct ASER survey. Of course, it's a rural survey, but we also conduct urban also in few districts. But we have not done the survey in urban settlements. So that was the second pilot that we did. And then, Hamza will talk more about it. We also have conducted early childhood education surveys through telephone. So that was our third initiative that we have done during the pandemic. That we have done. Thank you.
Thank you. That's great to know that you are able to reinvent yourselves and to find ways of digitalizing the ASER tools. Hamza, how was it to do the assessment on early childhood education by phone?
Yeah, so basically, initially we had planned 2 surveys that we were going to conduct in person, but due to the pandemic, we were unable to. So we redesigned the survey, we converted it into an online form, and then we took the contact numbers of children. And before that, we did a small pilot with around 15 children. We tried to see how you can talk to them over the phone, because as you know, young children, it's not easy to sustain their attention for a very long period of time. So we had to cut down the survey to make sure it's not more than 10 to 15 minutes. That was the first major task. And then we also had to make sure, the change that we had to make was that we had to make sure that their parents or their caregiver was with them throughout the phone survey. So that was a challenge that we did. And then we conducted a survey. We conducted it in 5 districts of Punjab, Pakistan. After that, we conducted another telephonic survey across 8 districts covering almost 2,000 households. By then, our team had built the capacity to conduct the surveys across phone. There were a few challenges. One of the biggest challenges is the unwillingness of the participants, because, as you know, when you go in person, it's not easy for them to refuse, but over the phone it gets a bit challenging. So that was another sort of roadblock that we faced. To that end, we developed a certain set of protocols that we expected the enumerators to follow. We can also share that protocols with you as well. So that is what we did. And once, you know, the COVID restrictions were lifted down, then we did a follow-up survey of those same children, and we did it in person this time. And there were some interesting results that we found out, because one of the things that I think it's worth sharing here is that during our survey, we found out that though COVID has had a lot of damaging effects for young children, there was also some positive dividends. One of the positive dividends was that because children were at home, parental involvement increased a lot, and parents did step up with children. So that was one of the things that we found out. And one other additional thing that we did was we also were looking not just for young children, we were also looking at what happens to young children with disabilities. So we also added a child functioning module from the Washington group of statistics. We tried to see what happens to children with disabilities during the pandemic. So that was one other thing that we did. Thank you.
Thank you, Hamza. Zain, you have been also engaged in this difficult journey of discovery of our assessments during the pandemic. What do you have to share?
Yeah, so as Hamza and Sehar has shared, that Pakistani had already been experiencing a very deeply entrenched learning crisis before the onset of COVID-19. And if we talk about the ASER data, we have seen that 75% of the children in Pakistan cannot read and understand a simple text by age 10. And also 24 million children's were out of school, and if we see that equivalent to nearly 47% of those aged 5 to 16 years, among these, like 5.6 million had dropped out of school. So in order to cater this out of school children, we have developed a second chance learning solution. We called it a Siani Seheliyan, or we could say wise friend, and we also say advancing action for adolescent girls, which support flexible schooling option for second chance education for the most vulnerable and disadvantaged adolescent girls aged 9 to 19 in the rural areas of the southern Punjab. And the girls the girls identified are those who either never enrolled in school or have dropped out in the past 24 months. So for the girls who never enrolled in school, our project offers them a 90 days course called Chalo Padho Badho, roughly translated to let us read and grow, which supplies a burst of remedial learning in literacy and numeracy domains. And for the girls who dropped out of school in the past like 2 years or less, the program provides them with an opportunity to finish the primary and middle grades. So this was the solution which ITA provide to cater the out of school children. And even the learning in the program is not envisioned as in the formal setting. Instead, it is tailored according to the learning level of each individual child, as recommended in the 2020 GEM report as the correct approach for the inclusion. And once the child comes to the learning center, we conducted 101 diagnostic assessment to undertake with the student, like to determine her learning level, and then and then assign a particular strand to continue his or her learning. So along with that, we have also tried to map the SLOs with the national curriculum, and for that we have aligned the SLOs with the textbook, and selected topics were taught to the students. And as far as the curriculum was concerned, this specifically designed curriculum covers and extensively syllabus in a very short period of time, and thus prepared the child to appear in the mainstream education. And we during the pandemic, we have also sought to ensure that the young girls do not face additional inequality and suffer further stress and anxiety during the pandemic. So girls were taught with the core life skills through short animated films, which we produced with our partners like Shamino Batch and I, so that it can create a positive change in their attitude and mental resilience, and thus teaches them with the values of leadership, communication, health and hygiene, and critical thinking ability. So moving from research to action, this was the one of the flagship solution which IT has designed in order to cater the out of school children, both during the pandemic and beyond the pandemic.
Thank you, Zain. We will come back to you to understand more about the results of this second chance program, specifically dedicated to young girls, and the results that you were able to see during the implementation. I'm really very excited to go back to that question later. Now, I would like to invite Hamza again, because you said something that was maybe unexpected, the positive dividends from COVID that increased the parental engagement. It's good to hear that. And maybe could you explain a little bit more? How was it, and which lessons we can draw as we are recovering from the pandemic?
Yeah, I think one of the main things that we have to recognize, and not just in Pakistan, but across all global South countries, is that parents are active participants when it comes to children's education, particularly in the formative years, age 3 to 7. So, so the thing is that when the pandemic came, one of the things that happened in Pakistan was that the government created a resilience plan for schooling, but it did not include ECE. And when they did plan for ECE, they did not take parents into account. So it was basically more of a supply side focus. So they were focusing on teachers. They were focusing on how teachers can reach out to children during the pandemic, during school closures. So they did not take into account the fact that there is an actor with the child who can help the child learn while the teacher is not there. Because we tend to assume that early childhood education or early childhood development is just something that happens in the school, which is not the case. It is also happening at home. And during the COVID, parents had an opportunity to really step up and engage with their children in learning, in their socio-emotional development. So we did a lot of questions that we asked were related to the fact that, did you read anything to the child? Did you play with the child? Did you, teach the child any numbers, counting, those sort of things, all those domains, literacy, numeracy, socio-emotional, executive function. So all those sort of things are something that we assume is something that the teacher is there to provide, but parents were already doing it. And when we actually looked at the learning outcomes of children, they were not as drastically low as we expected. So it means that during that period, during those months, something was happening at home, something that parents were doing right, that had made sure that even during the COVID, the learning losses were not as significant as we would have imagined. So that is something that the policymakers can take forward. That is something that the researchers can also look at, is that how do you involve this major actor, this major stakeholder, that is the parent or the caregiver, into the overall framework for early learning.
Perfect. That's something that we also we should also take into account. I think it's an opportunity for PAL Network and its members to see how effectively we can engage the parents. And I think from our perspective, parents have always been one of the key actors in improving learning outcomes. What we might need is to see how we will engage them, knowing the burden that they are carrying also at home, because they do have other responsibilities with the taking care of other children, looking for food for children, but there is still possibilities to combine and maximize their presence. I'm happy that your experience have some lessons that can teach all of us. Again, back to the Second Chance program, and this specific focus to girls. Was it possible to see a noticeable change with those girls who were involved in the Second Chance program, especially for those who have never been enrolled?
So I think yes, definitely. So for if I talk about the project, like we have been successfully able to mainstream around 45,000 girls. Among them, like 23,000 girls were those who were never enrolled in any school, and now they are being mainstreamed into the formal setting. And the girls I'm talking about, they also appeared in the official board examination for primary and middle grades, which was administered by the government, and we have seen that 92% of them cleared the exam. So, which is, I think, a huge success for this program, and this highlights its efficacy in helping children catch up on learning losses.
That's amazing. 92% of them passed the exams. That's really a good result. What do you think played the major role for this extremely high rate of success? Was it because they were working only among girls? Was it because it was a home-based activity? What are the factors that you think contributed the most for the success?
So there are two things. If we talk about for the girls who were enrolled in the CPB program, the process we used was the TALM approach, which is being used globally for providing the second chance to the never enrolled girls, and secondly, the second thing was we trained those teachers from the community, from their own community, so that they can replicate that thing within the community as well as in the government school, so that even after the project cycle end, the teachers can replicate that approach in the government school. So I think these were the thing which make the program successful, and also, as well as the content which we have provided was very innovative. It was very engaging. It was activity based, so the beneficiary engagement with the content was very high. And I think these are a few factors which made this program as a successful program.
One additional question is related to the specificities of working during the pandemic. ASER Pakistan was able to run 3 different surveys and to produce evidences on learning losses and on early childhood. So I know by experience that you usually use those evidences to engage with parents, to engage with other stakeholders, to develop your advocacy campaigns or activities to highlight the importance of foundational literacy and numeracy. So even if you have done with smaller samples, was it still possible to engage with policymakers and other actors in a dialogue to influence learning?
The other 2 surveys, which was for learning losses as well as for urban settlements, we have engaged with policymakers, we have conducted several dialogues, and we've also, tried to contact parents also, and did small, if you know that, even for ASER, we used to arrange very small community gatherings so that we can share the information with them. So, for urban settlement, this was absolutely a new survey. And we have done small gatherings with community members to engage them and to let them know that what was the purpose of the survey, how we conducted it, what were the findings. So we have conducted not only a policy dialogue to share our findings, but also we have conducted smaller community gathering also for dissemination purposes. Now Hamza can continue. Thank you, Hamza.
Yeah, thank you, Sehar. I was just going to, as Sehar has already told you about generally ASER, I'll just add a bit about the how we engage policy makers for early learning. So we conducted the survey and then we did policy dialogues across 2 provinces. We shared the micro data with the government policy makers, and then we shared some insights. And as I mentioned, particularly about this positive dividend that I have mentioned. So we basically provided some action points to the policymakers that they can take, that they can utilize for further. And there was quite a bit of uptake. Even now, there is quite a bit of uptake with regards to the findings from our survey, because one of the biggest issues that policymakers have faced is the lack of evidence during the pandemic. There is already very limited research that shows that what happened during the pandemic. So in that regard, I think our surveys provided a useful, point of view, a useful way to look at what is happening out there in the field. So in that sense, I think we were able to engage the policymakers. And then we also did a few focus group discussions with parents from some of the surveyed schools. So we shared our research with them as well to see how they would react, and whether the findings that we have come across, whether their own personal observations match that or not. So that is one other thing that we did.
At PAL Network, we are also looking for more and more information that can highlight how learning outcomes have been affected by the pandemic. We know that at one side, the pandemic just highlighted what we have been talking about for some years, that children are going to school, but they are not learning. And I think this opportunity of the pandemic just highlighted how big this problem was, and in some cases, it even got worse. So when you look at the data you collected about learning losses, and you look to your context in Pakistan, how can we accelerate learning for children, especially those who are most affected by the pandemic?
Armando, as you know that we have several learning solutions. The arm of service delivery that we have at ITA actually spans across all age groups. And the TAL program, the teaching at the right level, that was adopted from India. And then we had another program which Zain was mentioning about adolescents with girls. So we have these several programs that we think that of course can definitely help us out for actually addressing the learning losses and the issues of quality as well as retention. So all these programs were of course in place before the pandemic, and even during the pandemic we also tried that all of these programs should be kept on going, apart from digitizing a solution, which was extremely important, because we help the government out also by providing solutions to them so that they can reach out to the households. So I guess yes, at ITA we have our service delivery programs also, and then we are also digitizing our solutions so that we can help the marginalized kids and also address the issues of quality and retention.
I know that one of the priority areas for ITA is equity, inclusion, and learning. And any other comments in relation to how can we also focus on this topic of inclusion, equity, and the learning?
Yeah, I think so. There are 2 dimensions in particular that our research shows that we can also further explore. One is children with disabilities and how they are affected by the pandemic. I think there is a need that we recognize to collect more and more data on them, particularly looking at how, not just how children cope, but also how the school or the service provider has engaged with them, how the service provider has reached out to those children. One is that dimension, and second, the other is there's also a gender dimension. And I think Sehar and Zain can probably elaborate on how that occurs for senior grades. I can elaborate a bit for early learning, that there is a gender dimension that we found out. So we found out that when it comes to parental involvement, it's higher for boys compared to girls. Now the question is that whether there is some causality to it, whether there is something going on that we do not understand, or whether this is just a statistical anomaly. And that is something that we are looking to collect more and more data on to make sense of it. Because if there is a gender dimension, then that raises the question of equity. And that is something we are looking to explore.
If I was to ask how children with disabilities have been affected by the pandemic, 2 or 3 ways in which your survey results or reports found. How were they affected?
Armando, because even the kids who are marginalized, they have also been affected the most. And the kids with disabilities, and the solutions were provided to the households in general by the government for learning. But of course, we do not know that whether the children who had disabilities also had the access to the solutions. You see, so of course, during the pandemic, when the schools were closed overall, absolutely, there were learning losses occurring for all children, and for those with disabilities, of course, had been hit the most.
I think I just want to add that, over the time when we have done, now that we have done surveys telephonically, we have done it virtually. I think now there is a potential space, for doing researches of this kind. And, because researches like these can allow us to access some children which may not be accessed through traditional modes of surveying. So I think that is an important thing that we have learned, and that is something that we can obviously share our experiences so that other partners in Tile Network can also, expand their capacity in this regard.
You have done several assessments in different topics. The findings are very well aligned with our claims at the network to focus on foundational learning, to try to discuss equity and inclusion. With all this learning in 2021, how have they affected your plans for this year? So how is ASER Pakistan ITA going to use the findings and the lessons from 2021 to this current year?
Armando, basically, primarily what we used to do before the pandemic was that we used to conduct the household surveys face to face. And then, of course, it was a pen to pen. The other surveys that used to conduct also were using pen and paper tests. So now we thought because of the pandemic, somehow we cannot reach the household sometimes, or even the interventions also cannot be conducted in person. So that's what we learned, that, perhaps for the coming years at ITA, we always need to think a second plan B, and also, to digitize ourselves. So that is why we have now, even the ASER survey is now on a tablet. The monitoring also for some of the program is done on tablets. As Hamza mentioned, if we've conducted telephonic interviews also, just to see that whether we can do it and what kind of results do we get, how can we monitor them, how can we ensure data quality. So those are the results that actually, after conducting these smaller pilots, actually now we have gathered, and definitely they will inform all our interventions in the coming years.
And Madhu, I just want to add one thing. As well as service delivery program are concerned, the accelerated learning program is already in the process of adopting the distance learning approaches. Like right after the COVID-19 pandemic was recognized in Pakistan and the lockdown policy announced, we started working on digitizing the key content from the syllabus, and now steps are being taken to explore further low-tech solutions such as radio and TV in order, if we have like such pandemic in the future, we must be prepared for that.
Learning and adapting our interventions to the new context, that's fantastic. But now I just wanted to ask a general question Where do you get the inspiration to do what you are doing?
So I think the first motivation was to like see the people like Bela and you working in the education sphere so tirelessly, and secondly, I think like I was also belong to one of the marginalized communities, so that was something I think was very motivating for me to like work for the girls and for the out of school children to whom I could support, or even my small effort can create a big difference in their lives.
The biggest source of motivation and the inspiration that comes for us is in the field, when you go out and you talk to parents and you talk to children and you realize that sometimes we tend to assume that there is a demand side issue, that parents do not want their children to learn or they do not want education for their children, which is not true. They do want to learn as much as their resources allow it. And I think in that sense, it is important for us as researchers and as practitioners to make sure that we guide the systems towards a place where they can be beneficial for these children and for these parents. I think that is something that has to drive us forward.
Once again, when we started this conversation, we said this is a space for sharing what is happening in different geographies. And it was really a pleasure for me to get updates from ASER Pakistan, from ETA. Thank you very much for your time for this conversation and for developing so innovative ways of doing survey and applying the findings to action. We are very proud of your achievements. We will continue sharing lessons from Pakistan with other members, and we really look forward for a very successful 2022 for your team, for your country, and especially for all children in Pakistan.